Hi everyone, welcome back to my channel. Today I'm going to be making a video about the American healthcare system, greed, and why I believe healthcare is a human right. There is a clear consensus that the healthcare system is failing us, and particularly from an American perspective, the healthcare system is failing, right? I'm thinking from a British perspective, and I still can see the way in which the healthcare system is failing us. But there are certain things that I have access to that, especially growing up as a working class woman, that I would just have not had access to if I was of a similar class position in America. The healthcare system is failing ordinary people, and healthcare is very clear is considered something that is a privilege, not something that we should all have access to. When these arguments are made, it's just shot down, and you have very conservative, Republican, right-wing pushback from people stating that money doesn't grow on trees, that this is just the way things are. But what if this is not the way things have to be? That is all we are simply saying on the left. We're trying to recreate or trying to reimagine. How does the US healthcare system work? In the States, there is no NHS. If someone gets ill, it's likely they will have to pay for their treatment. The US government does fund two kinds of healthcare plans, though: Medicare and Medicaid. They are especially designed for elderly, disabled, poor, and young. However, many Americans have their healthcare paid for by their employer. It's often included as a fringe benefit in job packages, but some aren't as lucky. According to the US Census Bureau, in 2007, almost 46 million people in America didn't have health insurance. So that really creates a picture of the environment in America right now, and the stress that having to balance your life with healthcare debt. Is access to healthcare something that is essential versus non-essential? So, as I was suggesting earlier, the Republican, conservative, functionalist, right-wing perspective in these spaces, right? It is always up to the individual to ensure that they have access to healthcare. The business has priority in terms of what is seen as important. We even see that in American politics when you look at how much money is even involved in the election process, how much money is thrown at the chosen candidate. If someone has failed to gain employment or employment which pays them enough to access things like high quality healthcare, it is their fault. It is their fault, sorry. It's just always blaming. And rather than reflect on the system, which essentially operates against our interests as working class people, as ordinary people, it's just essentially justifying a world that prioritizes profit, where the wealthy severely underpay workers in order to achieve their economic benefit and class position. So in that context of healthcare being something that's non-essential, it's about business, it's about making that money and prioritizing the interests of the rich. Differential treatment is just, you get what you pay for. What's the big whoop? What's the big deal? That is definitely the sort of perspective that we hear often. In 2022, United Health Group made over 20 billion in profit. Cigna made 6.7 billion. Elevance Health made 6 billion and CVS Health made 4.2 billion. America's largest health insurers ranked more than 41 billion of profits in 2022. So this was the article, which I'll put the source, which highlights the amount of money these health insurance companies are making. And there's always going to be someone that needs support, is recovering from an accident, is struggling with the health condition, is navigating, their mental health experiences and things like that. So they know that and they use it to their benefit. And I think it's such a cruel industry when you really think about it. If you need support, you need support. It's not something that is optional, so then you lose your life. And just around this Luigi situation, seeing all the stories that people were sharing of losing their family members, friends, people they knew, it was just horrible and it was really heartbreaking. And it made me realize I was really ignorant to the realities of the healthcare system in America. Access to healthcare as essential. So I remember when I was studying human rights, which we know is the whole thing of human rights is interesting and there's a lot to unpack there. But there's a term called universalism, which essentially means that it should not be based on who you are, where you're born, etc. That everyone should have access to a good quality of life, access to diagnosis, treatment, and support which reflects their unique needs, right? And I think for me, there should not be. People are gonna be like, lefty. I'm like, yeah, that's me. But these social inequalities and hierarchy, this is not inevitable. They want us to believe that. But these differences are generated by society. They are reproduced by society. They're not normal. They're not natural. They should not exist as a result of one's gender identity, age, relationship to their body, disability, mental health, the color of my skin. Like, we've seen the I think 4 or 5 times more campaign, which is around maternal health outcomes for Black women. Why are Black women more likely to die at childbirth? That is showing you these systematic elements, right? Healthcare should be of high quality for all, rather than reinforce these systems of oppression. The number has gone down as a result of their campaigning, right? Yeah, so in 2018 and 2019, it was 5 times more. Now it's 2.9 more times more. Reading so much around this topic of healthcare, I feel like we deserve better. The Americans deserve better. Like, everyone globally deserves better. It's seen as such a thing that is like very like a rarity to have access to that, to feel treated and respected correctly by your doctor, or to have an access to a diagnosis, or like all of this is there's so much barriers, there's so much stress. Like, life is stressful enough as it is, and then I think the reality is we're all likely to have some health issue in our lives, especially as we get older. So on a personal level, it's important to think about this issue, but then also it's in terms of those in our community. Even if we are not first-hand affected, are we okay knowing that people are struggling to pay for surgeries? I remember that healthcare company where there was a conversation around, because I'm still kind of figuring out the American healthcare system in my mind, but the idea of having to pay for anesthesia, I'm still baffled. Like, what the hell? We shouldn't just say this is just the way it is. We shouldn't accept that, right? And that's my main argument in this video. And I think COVID in particular, and the dialogue and even conversation around immunocompromised people, and the way that essentially they've just been ignored and just pushed aside as if their experiences and struggles are not important. You know, it's just back to the office, back to in person. I think it was Rishi before he left talking about we have to make sure that people that are not working actually are not able to work. Like, that whole ableist narrative that people are pretending to have a disability or to have a mental health experience or gross, okay? Please let me know what you think of today's video below. Thank you so much for listening. I have a really bad cold, but for some reason it's kind of eased up a bit, and I'm starting to feel a bit better, but I'm glad I actually stayed up to film this video. Okay, thank you so much for listening, and tune in for my next one. Bye.